what I'd like to do is just segue as we end here to some other work that you do. My understanding is you're involved in the Penn State Child Maltreatment Solutions Network, and which I think is focused on some different challenges, different issues, different populations. But I was wondering if you might talk a little bit about your work with that.
Sure. So I work with this dynamic group of people. Penn State had a great response to say that they wanted to bring researchers across different disciplines all to come and actively be working on child maltreatment solutions. So within that opportunity, we have come together. We were just successful in getting National Institutes of Health funding for a capstone center, which is really kind of an unprecedented opportunity to have the first national center focused on providing research and training in this area. So to that end, I work teaching in the Child Maltreatment and Advocacy Studies minor that was created by the network. So we bring undergraduate students from multiple disciplines together, really to be thinking about child maltreatment before they ever leave Penn State. And that provides yet another place where if they know about the work of forensic nursing, they know what a social worker might do, and they have some understanding of that, it's another place where we can potentially grow the workforce and put people out who are actively understanding the problem and ready to be out in these more rural settings to work together to solve that. So that's one great thing that goes on within the network. And then the second with this new capstone project is that we have a couple large research projects, but we also have a dissemination and outreach core, and that's something that I'm part of, where we are building community collaborations, bringing in stakeholders, similar to what we're doing in the Safety Center, making sure that we have voices from these communities and understanding what do they feel are the most pressing child welfare needs to be solved. And then our research group is really trying to come up with demonstration projects such as telehealth about how do we solve some of those things, and can we do that through, how can we best deliver evidence-based practice? How do we help communities evaluate what might be the right solution? So those are some great opportunities I think we have ahead to really make a difference in the area.
Yeah, excellent. And I think in the spirit of community-engaged research or even community-based participatory research, I think this is certainly the kind of work that's really important, right? To sort of identify what the needs are in communities, to be partners and true partners from a research perspective, and help to bring science and design to solve those. So excellent to hear about this work. So maybe as we end, give you an opportunity if there's anything else that you'd like to just make sure that our listeners are aware of, but also maybe how they might get in touch with you. I don't know if you have a website or just we can certainly make your email address or contact information available, but I imagine a lot of our audience might want to have follow-up questions and might want to be in touch to learn more.
Absolutely. Well, it's been a great opportunity to be able to talk about this program, and I would welcome anybody who has an interest to reach out. My email is smiyamoto, so that's SMIYAMOTO @psu.edu. And we are working on a website that should be up soon, and I will let you know when we have that up and running.
Great. Well, good. Thanks very much.
Thank you.